It's really important that in order to find the right pathway for you with your management that we go through the pros and cons of any of these options. So if you have any questions, then fire away. 75% of people that have mental health conditions will have developed them before the age of 25. So getting it right at an early age is really critical. In terms of engaging, it's really important to have what we call shared decision making, where you're working on this together and you're coming up with a plan together. You really need to get a sense of, well, what's the young person interested in? I like using the choosing wisely questions, the 5 questions. First one being, do I really need this management option? Are there risks? Is there another option? What happens if I do nothing? And what are the costs? And the costs can be financial, but they can also be time, emotional costs. Same thing goes for medication, that if somebody is to be prescribed a medication, they need to be across, well, what does this medication do for me? What are the side effects? Is this going to have an impact on things like my sexual performance? What about drugs and alcohol interacting with this medication? What happens if I want to stop this medication?
The only treatment I'm on right now is melatonin, so helping with my sleep. So when I started taking melatonin, my GP went through all the ins and outs of the side effects, what I can expect, the long-term usage of melatonin, and that really did give me a lot of confidence.
NPS MedicineWise has some great resources. So there's Find a Path for You, the resource that you can use with a patient, and you can go through that together and fill it in, and they can then take a copy of it or put a copy of it on their phone. And once again, if you have a template that you can follow, it often gives you great talking point prompts. It's really important, I think, to give that young person a sense of ownership with this. It is their lives, their health, so their opinion really matters. Some of the lifestyle interventions that may be really useful are things like sleep, improving sleep, exercise, connection with people, friends, nature, scheduled activities where they know, okay, well, this is what I'm going to get done today. The worst thing you want to do is prescribe stuff that is of zero relevance to a young person.
My plan for my anxiety really is self-care, number one, doing things that I enjoy, but that's also beneficial for me. So physical well-being, going to the gym, going for walks, or having a good skincare routine, or even the smallest things like reading a book next to the sun shining on me through the window. Just the smallest things. They've helped a lot.
Digital therapies have shown to be very successful in managing CBT, cognitive behavioural therapy, online for conditions like depression and anxiety. And these can be free. Most young people who have the right skills and support become well. They go on to have rich and wonderful lives. And that with the right support, engagement and opportunities, that the future can be very bright.
In terms of goal setting with my mental health, I've come up with a few goals for myself, which I would say are a bit more ambitious, to be honest with you, but my GP has definitely stepped in and taken a lot of recommendations for me to handle, like being consistent with exercise regularly and being consistent with self-care and not missing 2 or more days. It's been very practical from my GP side, and from my side it's been more personal, things that I wanted to develop myself in. So a combination of 2 goal setting has definitely helped.